And we know it's a big problem here. In fact, part of our area leads the nation in an alarming statistic. People in Martinsville are prescribed more opioids than anywhere else in the country. And that's according to a recent study by the Centers for Disease Control. WSLS 10's Rachel Lucas spoke to doctors about why that is and tells us what the community is doing about it.
A problem so serious, so prevalent, it means going door to door to every home in Martinsville to talk about the issue.
Give you information about the opioid epidemic that's in our area.
Although Martinsville is home to fewer than 13,500 people, they on average are taking more doctor-prescribed opioids than any other place in the country.
We're #1 in the nation, and we're working on that.
According to the CDC, clinicians there prescribed almost 4,090 morphine milligram equivalents per person in the year 2015. And to put that into perspective, the national average was only 640 milligram equivalents per person.
We've had problems in our community in that our rates of likely opioid addiction, as well as opioid overdose and opioid deaths, are higher than what we would like to see anywhere, but higher than the rates around the country.
Martinsville Memorial Hospital announced it had seen a 40% increase in emergency room visits due to opioid overdoses last year. Why Martinsville? Dr. Mark Greenewald with Carilion says it could be in part work-related.
That is a population that has a lot of occupational injuries because of the kind of work that's been done there historically. And so if you look at that whole map, there's a lot of folks who have made their living through physical labor. With that comes a lot of injuries. With that comes a lot of chronic musculoskeletal problems. And so you can start to see why perhaps those particular patients were started on these kinds of pain medicines in the first place.
While the labor industry was booming in Martinsville, opioids were still being pushed by the National Medical Association as a non-addictive form of treatment.
I don't think we anticipated this when we started using these medications years ago to control pain, is that within 3 to 7 days, an individual can be addicted to an opioid.
But now that doctors know, where are all these prescriptions coming from? We asked health leaders at Sova Health in Martinsville and at Carilion, both leaders in the industry and the area, who not only began addressing the issue years ago by limiting prescriptions, but whose numbers show it's not their doctors.
Quite frankly, we've been maybe a little bit ahead. We've been working on this through our emergency room for over a year now, changing the way prescription medication, particularly opioids or pain medication, are prescribed through our emergency rooms.
It was very surprising for us because we do know our data for our Martinsville practice, the Carilion Martinsville practice, and that data is not out of the ordinary with the rest of our practices. And so, again, the way I interpreted that was, I don't know who's doing that, but it's not our practices.
Now under investigation by the DEA, a Martinsville doctor of osteopathic medicine, Dr. Joel Smithers, who operated the Center for Integrative Health at Smithers Community Healthcare, was recently arrested and charged by federal authorities with illegal possession with the intent to distribute Schedule II drugs. While awaiting a trial, this licensed doctor is no longer allowed to prescribe. Although he works in Martinsville, he's from North Carolina. Police tell us that state line is a big part of the problem, even skewing Martinsville's numbers as North Carolina residents come here to fill their prescriptions and vice versa, untraceable so that they can doctor shop in 2 states.
Physicians are realizing that we are part of the solution.
The Virginia Board of Medicine now has new laws limiting the amount of opioids doctors can prescribe, and in most states it's monitored.
The prescription monitoring program basically allows us to see all the controlled substance prescriptions that have been written for a patient. We can do that, and we have what are called reciprocal agreements with 22 states around the country, including West Virginia, including Kentucky, including Tennessee, including Maryland. But right now, as of 2017, we don't have that with North Carolina.
A loophole that allows those addicted to opioids to fill prescriptions in 2 states without being caught by police or even doctors.
Doing information about the legal prescriptions or opioid problem.
Face to face, the medical community is now working alongside police and community organizations to reverse the effects.
We're just trying to get a foothold here to make people more aware of it, and education is the key.
Between 60 and 200 homes are visited by volunteers every Saturday to talk about the dangers of opioids.
Overdoses, whether intentional or accidental, the medications fall into children's hands, that people might not be aware of what they actually are prescribed to take, not aware it's opioid medication.
We have to educate the young not to use, and we have to educate maybe the elderly, maybe the grandparents that don't realize that having their prescriptions available in the prescription cabinet can be an invitation for someone to take a few.
Community efforts Martinsville is taking in the right direction, although they know it's going to be a long road ahead.